Hi, this is Dr. Greg Gorman. I'm doing a series of videos about things you will see in clinical practice that you did not learn about in school. Today, I want to talk about people who are used to having strain, sprain type injuries, going to the chiropractor. They feel immediately better when they get up off your table. They are singing your praises on the way out the door. I usually tell them to say it loud on the street so people know. But we know if you've been in practice even a month, you know that that is not always going to happen. There are people who every time they go to the doctor, they feel so much better when they leave. And I'm talking to the chiropractor, not the medical doctor, because we know that's a whole nother thing. So they're used to that. And then something happens like a herniated disc, or they have a peripheral nerve entrapment. And it takes a whole series of sessions. This is also true of people who've had gross trauma, like car accidents or slips and falls also. But those people usually know when they walk in that it's going to take a little bit more work than they're used to. But the people that just wake up and they suddenly have leg pain and a little bit of numbness and tingling in their foot, or the similar thing with the cervical spine herniation, you'll get the arm pain, tingling in the hand, or weakness. And they're not really sure what's going on. They've never had it before, and they come in, and they're expecting that you're going to snap, crackle, pop them out of the pain. They're going to walk out as happy as they have every other time, but that doesn't always happen. Now, there was a specific case I was thinking about that I wanted to share with you all. I was in Boston. I went to Boston after I graduated from Life West, and I worked for a doctor in the Back Bay. He was an awesome guy. He was a mentor, still a close friend. And I took all the emergency patients for him, which was an awesome experience. But this particular guy was a friend of a friend, and I think I'd been in practice about a month, and it was one of my first referrals. So I really wanted to do a good job with this guy. And he came in with a classic presentation of sciatica. I believe it was the left side. I think he was pushing 40. He was I think he was a psychotherapist. So, they always have terrible backs because they sit all day and they usually cross their legs too, which is the worst. So he came in and he'd had a lot of experience with chiropractic. He wanted to try me because I was new. And of course, he knew that I was new. He knew that I had just graduated from school in December, and I think this was April. So he started coming in, and I was really excited because I thought, I just know exactly what to do for this guy, because it seemed like a sciatic nerve entrapment to me. I couldn't tell because we hadn't done the imaging yet. But I figured, this is going to get better pretty quickly. And even in school, when they talked about the discs, they kind of intimated that you were going to, do a nice, solid, specific side posture adjustment, and you're going to suck that nucleus back in, and they're going to be out of pain. Maybe not. Discs are inflammatory conditions. It's not cartilage or jelly pushing on a nerve. It's a big inflammation, and it takes a fair amount of time for them to heal, if they ever do. Some people have to have surgery. So, they did not stress that very much in school. We got a lot of the hyperbolic language. In fact, I recall one doctor in a seminar. I think he was an AK doctor, and he was telling us that he had a good friend who was another chiropractor who had a classic presentation of Cauda equina syndrome, and he was begging the doctor to do side posture on him. Now, we all know that's pretty much a medical emergency. You don't want to mess around with it. I'm not really sure I would do that. But he said he adjusted him and it all went away magically, So I'm not really quite sure I buy that. Those doctors that would come to speak to us as guests at school had a lot of hyperbolic stories. Some were true, but I think there's a lot of exaggeration that goes on. So I had that in my head. And I also had in my head that, oh my God, you're new. You may not know what you're doing. And maybe the reason that he's not getting better is because you don't know what you're doing. So anyway, I'm struggling with that. And I could kind of tell that he was, kind of thinking that as well. He was a little hesitant about scheduling appointments. But I was very enthusiastic and I really felt like I could help him. But it just wasn't getting anywhere. So I sent him out for an MRI. Turns out big, juicy L4, L5 disc herniation. So there is the reason that I could not do a snap, crackle, pop and send that guy on his way out of pain. So you're going to encounter this in practice. I mean, it's pretty much a given. There will be people who do not respond to what you're doing for them. So you do need to ask yourself the question, am I doing this right? Am I doing everything I possibly can? But I'll tell you that I think that you probably are. Most people that come out of school that get their licenses, no, we know what we're doing. You know what you're doing. The schools prepare people pretty well. Some schools better than others, but I think in general, you generally know what you're doing. And honestly, it's not rocket science after a while. So if it's not responding the way you want, please don't hesitate to get imaging or to make a referral to the medical profession. It's not a failure if you're not getting these people better quickly. Maybe it's just how they are. One of the best things I think you can do in clinical practice is just keep in mind it's not about you. Don't take it personally. You're here to help people. We're here to help. We want to help. And of course, we're going to freak out a little bit if we're not helping. But if you're not helping, maybe it's because you can't help. And this is not something that we heard a lot about in school. We heard about the fact that we're going to create miracles. We're going to save the world one spine at a time. And sometimes the reality is a little bit more mundane than that. Take it seriously if you're not getting people better, because I've seen tumors, I've seen multiple myeloma, I've seen other types of cancer. One gentleman that we found the cancer because I was treating him. The pain wasn't getting better. He died. He died. The cancer killed him. And, you got to just keep that in mind. Don't be afraid to make a referral out. But in these situations, it's really important to not take it personally. It is not about you. It's not about your skills. You're probably doing everything right. It's just that this is going to happen sometimes. And the people's expectations are totally for something different. So educate, communicate, talk about what's going on, make appropriate referrals, but don't blame yourself. And again, don't take it personally. If this is ringing true for you, if you're liking what I'm saying, give me a call. I'm coaching, and I can give you what my boss in Boston gave me, which is be an excellent mentor. We need that in the profession. You need it if you've been in practice for 10, 15, 20 years even. I still need that. But there's no structure to get that. And I think that having a coach, especially a coach that's been in practice for 25 years, is an excellent thing to do. You'll take your practice to the next level and you can be a lot happier. So I'd encourage you to check out what I've got to offer and give me a call. Thank you.